Hi, this is Maureen Heberly. This is my video on the cranial nerves for BI 201, Anatomy and Physiology, Professor Lane's class. I do not have a subject, so I'm going to use my trusty skeleton, who can't respond to any of this, but I'll at least walk through the steps. The first cranial nerve is the olfactory, which is the sense of smell. So what we first do is we have them breathe through each nostril to make sure there's no blockage and there's good flow. Then we take on one nostril, they hold one side, and then we introduce a smell so that we can see, and if they can identify it, they have to close their eyes during this time. Then we introduce a smell to the other side, and if they can identify both smells, then we have a pretty good idea that they can actually smell pretty good. Cranial nerve number 2 is the optic nerve, and there's several nerves that all correspond with the eye. This transmits signals from the retina to the brain. So what we do is we would have our subject block one eye and then block the other eye to see if they can read or identify things from each eye equally. Because sometimes one eye may actually be stronger than the other. Next is cranial nerve number 3. This is a motor nerve. It's oculomotor. It is part of the superior orbital fissure, and it performs most of the eye movements as far as going up and down and rotating for our vision. Cranial nerve number 4 is the trochlear. It is also a motor nerve, and it rotates the eyes laterally. So on a subject on a test, we would want to come in from the side and the other side to see exactly where they can identify and how far out they can see, like a peripheral. The cranial nerve number 5 is trigeminal, and it's a motor nerve that innervates the muscle face, the frontal masseter, and it would be over here, and we would open and close the jaw, and you can feel the masseter over here, and so that gives you an idea if that works. Cranial nerve number 6 is a motor nerve also. It's the abducens, and it abducts the eye. Abduct is away from. So, our different movements, from center are going to be under this cranial nerve. Cranial nerve number 7 is the facial nerve, and it is motor and sensory, and it controls all of our different facial expressions, smiling, frowning, showing our teeth, squinting our eyes. All of those are going to be part of our facial expressions, raising our eyebrows, and also the sense of touch, like touching the face, whether it's sharp or dull, and seeing if they can identify that. Number 8 is a sensory nerve, and is the vestibulocochlear, and it is the internal acoustic canal, and that is inside the ears on each side. And what we can do is you can take the fingers and rub the fingers together and go away until you can see if they can let you know if they can no longer hear it. When that's done, you can also use the tuning fork, which is a much higher pitch and much louder, and do the same thing, and it can usually goes as far as the shoulder. The number 9 is the glossopharyngeal, and this is part of the jugular foramen, and this is all about swallowing. So you can watch someone, you can give them water, or sometimes you can just touch their throat and they will have an automatic reflex to swallow. Number 10 is the vagus, and it controls the muscles of the voice and the soft palate, which of course are also going to be up here underneath the throat. The accessory is a motor nerve, and that has to do with shrugging our shoulders and turning our head from left to right. The number 12, the last one, is the hypoglossal, and that is also a motor nerve, and that is where an individual is strictly with the tongue, and you would have them stick out their tongue and move their tongue from side to side to make sure they can do this. And that is it for the cranial nerves.